Bright reports evidence from camel-to-human transmission of MERS coronavirus. Definition: MERS-CoV is a newly identified human coronavirus that has recently emerged in the Middle East region. Current epidemiologic data suggests multiple zoonotic transmissions from animals reservoir leading to human infection, sometimes with secondary transmission events in humans.
7 things you need to know about MERS-CoV. What is MERS-CoV? It's the Middle East Respiratory Syndrome coronavirus. First reported in 2012, this strain of coronavirus causes acute respiratory illnesses in affected patients. While most cases have occurred in the Middle East, the virus has spread to other countries. There are 2 possible ways of transmission: from exposure to infected animals or humans. Those in close contact with infected patients have a higher risk of infection. Currently, there has been no evidence of sustained human-to-human transmission in the community or airborne transmission. What are the symptoms? They include fever, cough, and shortness of breath that might progress to a more severe acute respiratory illness. Here are some ways you can protect yourself and others. Observe good personal hygiene at all times. Wash your hands frequently. Wear a mask in crowded places and seek medical attention if you become unwell. Avoid consuming unpasteurized milk, undercooked meats, and eggs. Avoid contact with camels, poultry, birds, and other animals. Avoid close contact with persons suffering from acute respiratory infections. For now, there is no known cure, vaccine, or any specific antiviral treatment. Infected patients can get medical help to relieve the symptoms. The Ministry of Health and healthcare institutions have measures in place to monitor the situation and contain the spread of the virus should it emerge in Singapore. If you become unwell within 2 weeks of visiting countries with reported cases of MERS-CoV, wear a surgical mask and seek medical attention promptly. Inform your doctor of your travel history. For more information, visit this website for the latest health advisory.
Application in medicine. The nasal swabs collected from an infected patient and camel are later inoculated with viral cells. Then, after 3 days of inoculation, may be able to show if the cells present a cytopathic effect in the form of detachment of cells.
What is your expectation from this meeting?
I expect this meeting to establish a list of MERS coronavirus experts from all over the countries and national laboratories who could be readily consulted for technical advice and also who could be deployed for international MERS coronavirus missions. I expect this meeting to understand what best practices has been well worked for the member countries and also to contain transmission of MERS coronavirus from camels to humans. I expect this meeting to provide insight into what worked well and what has been done to contain the transmission of MERS coronavirus from camels to humans.
Current scientific evidence suggests that dromedary camels are a major reservoir host for MERS-CoV and an animal source of MERS infection in humans, although the exact role of dromedaries in the transmission of the virus and the routes are unclear. What is OIE's role in understanding this process better, and why is it important that we understand it?
OIE as consulted is OIE ad hoc group on MERS coronavirus experts to define a case definition for reporting positive and confirmed cases to OIE. This information is crucial to understand the relationship between MERS coronavirus in animals and humans. And also OIE is working again to consult this OI ad hoc group on MERS coronavirus experts to update and draft a chapter in the OI terrestrial manual for validated diagnostic tests that can be utilized by the member countries and laboratories for improving surveillance that could be applied in their territories.
Pros and cons. Pros. There is no easy human-to-human transmission, only from animal, as camel-to-human. That's why it is a zoonotic virus. If it is diagnostic in early stage, it can be treated as a common cold. Cons. No vaccine or specific treatment is currently available. However, several MERS-CoV specific vaccines and treatments are in development. It can be confused with a normal cold, and delayed diagnosis is hard to treat. That's why 35% of the case ended in death. Issue applied in Ecuador. Since 2012, 27 countries have reported cases of MERS, including Egypt, Oman, Qatar, and Saudi Arabia. On the other hand, there hasn't been any case reported in Ecuador. Conclusion. MERS-CoV causes a zoonotic infection that can be infect dromedary camels and can be transmitted from them to humans through close contacts. Camels may act as immediate hosts that transmit the virus from its reservoir to humans, and the exact reservoir that maintains the virus, its ecologic niche, has yet to be identified.